Let us now go to pulse taking. The topic is soft pulse, also known as soggy or weak floating pulse. The soft pulse has three characteristics: floating, soft, and thread-like. The clinical significance of a soft pulse indicates an illness of deficiency or of dampness, principally Qi deficiency, severe blood insufficiency, spermaturia, diarrhea, spontaneous sweating, severe fright, dampness attacking the exterior, or strong dampness in spleen insufficiency. It can also occur in contagious illnesses of the stomach and intestines. The development of the soft pulse in an illness of deficiency is due to insufficiency of yin blood so that yang qi cannot be restrained. This causes the vessels to become partially empty and yang qi to float to the exterior, hence the soft pulse. Internal accumulation of dampness also causes blockage of the vessels, hence also the development of a soft, thread-like, and floating pulse. The soft pulse, like the thin pulse, is very fine, but the soft pulse can only be felt at the superficial position, whereas the thin pulse can be clearly felt at a sinking position. The clinical significance of a soft pulse usually indicates damage to the yin blood. The soft pulse must not be confused with the weak, minute, or thin pulses. The soft pulse, like the weak pulse, is thin and without strength, but the soft pulse can only be felt at the superficial position, whereas the weak pulse can be felt at the deep position. The soft pulse, like the minute pulse, is floating and thin. However, when pressure is increased, the soft pulse cannot be felt. This type of pulse that appears after a severe disease or after childbirth indicates that the body has not recovered from damage to the blood and qi. A weak pulse is a pulse that is felt to be very soft and thin under deep pressure, but cannot be felt at the superficial level. In summary, the soft pulse has the characteristics that are superficial, forceless, and thread-like. The analysis is deficient yin blood, with vessels not full and yang qi is floating. There's dampness accumulated and blocking the vessels. The clinical significance is illness of either deficiency of qi, blood or fluids, or dampness. There's dampness in the exterior or spleen insufficiency with strong dampness. Thank you so much for your attention.